Hi, I'm Mary and I'm 28 years old and I'm from Shropshire. I was diagnosed with breast cancer in 2020 at the age of 27. I was diagnosed with stage 1 but grade 3, an aggressive form of cancer. It was HER2 positive, estrogen positive and progesterone positive, so triple positive cancer. My tumour was 1.6 millimetres in size, so caught fairly early, and I didn't have any spread into my lymph nodes. But I was given the full shebang of treatment, as my oncologist called it. I had lumpectomy to remove the cancer and then a sentinel node biopsy to ensure that it hadn't spread into my lymph nodes. Following on from that, I did actually undergo fertility treatment because of my age to make eggs and embryos. And then I also then started chemotherapy after that. So I had 6 rounds of aggressive chemotherapy called FEC-T, the different drugs. So yes, I lost all my hair. I experienced all the lovely, aches and pains that go with chemotherapy. And that went on from July to October. Following sort of on from that, I did have radiotherapy as well. I had 9 rounds of radiotherapy, which was done in a shorter period of time. So it only went over 9 days as opposed to weeks. So I had that just to my left breast. And then I also am now on hormone treatment. And I also still have Herceptin injections to target the HER2 protein that was growing in my tumour. So I will take my hormone therapy tablets every day for the next 5 years, and that's to ultimately sort of block estrogen, to try and, because my cancer was estrogen positive, to try and obviously prevent any of my cancer coming back. So everything from that point of when my tumour was taken out of my breast was preventative treatment, the belt and braces as they call it. But yeah, I was given sort of everything was thrown at it, and yeah, I think I've had my first clear mammogram this year, which is fantastic. But yeah, obviously going through something, cancer in general, and then going through it at such a young age, it's very difficult. And it comes along with a lot of changes to your body, not just losing your hair, which is obviously the physical changes, but the aches and the pains that I was talking about, the skin changes, and things like that. It's amazing how much it can change your body. So yeah, there's lots of different things to tackle that you probably don't realize when you are diagnosed, that different sort of things that are happening that you've got to combat, and try and find ways around them. So yeah, it's definitely been, it was a tough time, especially during COVID, but yeah, we've got through it, and hopefully lots of clear mammograms going forward in the future. So when I was going through my treatment, I did find it important to try and combat some of the different things that I was experiencing with my body and my skin and things like that. So I sought some sort of additional help with things like aches and pains. That was something that I really, really wanted to combat because I really struggled, and I did carry on working. So I was, working from home as we all do, and yeah, I struggled with not being able to be as mobile. So trying to combat all that. So I was referred by my GP for physiotherapy because I did have really, really bad back pain, which I did have physiotherapy for 6 weeks, which is, I think, the one of the normal sort of programs that your GP refers you for, or 6 sessions, something like that. And so yeah, I did do that, and it was helpful, but I didn't feel like it was enough. So I did look at additional physio from a sort of non-GP referral. So I went and had that done, which definitely helped. And then I did want to look into having regular massages for my back and for things like my scalp as well. With losing your hair and how sensitive that is, your scalp becomes quite painful. So I looked into having like a head, neck and shoulder and things like that to sort of help and also make yourself feel better. But there was instances where just going to my local sort of place where I would normally go for a massage pre-cancer, they were very, very skeptical about giving me any sort of treatment because they weren't comfortable with the fact that I'd obviously had lymph node removal and so soon after treatment. they were not comfortable with doing those sorts of treatments on me, just in case it had any implications. And I obviously didn't realize that that would be the case. And then you do sort of worry and think, oh, I've been having physio and I hope that's been okay. And but you know, I definitely felt there's a lack of sort of understanding, you know, because a lot of my nurses on the chemo unit were saying, go and have this done, and then they were turning you away. So it was quite difficult to sort of figure out, you know, what was the right and wrong thing to do. Sort of another huge thing for me was I actually found out about Look Good Feel Better, charity obviously to help with those sorts of changes with makeup and hair, and not small things now, but I was really struggling with a loss of identity. You know, not just by wearing makeup to just wear makeup, but just to feel like myself again, not having eyebrows and eyelashes, and you really do lose a little bit of that sense of identity. So I registered for a couple of their courses, hair loss and makeup, and they were a real game changer for me. I really enjoyed being able to not only talk to professionals who understood the types of products that we should be using on our skin, and asking questions about combating certain issues with sensitivity or things like that. They obviously gave their professional opinion, and I trusted that. But I also got to meet a lot of other people going through similar situation to myself. So that was really important, and I felt really comfortable with their knowledge, and yeah, they really helped me sort of get to feel a little bit more like myself, which was really important. But it was just finding the access to those things. I purely came across Look Good Feel Better courses through Instagram, just by chance. But yeah, I sort of never really have been given anything or signposted into anywhere that I you know, I know that they're definitely okay to give these sorts of treatments for someone who's been through cancer treatment, because obviously being turned away once, you kind of get a little bit nervous to go back again. But I think it's so important, because it's not just treatment, you know, that you're taking and the physical changes, it's all these different things that are happening inside your body, and it really does change you. And you know, you've got to try and figure out ways around those things. You know, radiotherapy is very harsh on your skin, so just to have different therapies to help with that, you know, aside from the usual things they tell you and in hospital to do, it's really important that we have these available for people. So yeah, I definitely would say that I sought after a few, but I was definitely a bit turned off to when I obviously got turned away. But it would be really nice to be able to have access to more services, and to also bridge that gap between the knowledge of, you know, the clinical knowledge, and then, you know, the wider knowledge of people in the community who are running salons or things like that, who know that they can do these treatments and that it is safe. So yeah, I think there definitely needs to be a gap sort of bridged between that knowledge.